Practitioners in mental health often use questionnaires to understand more about different aspects of your mental health, to measure problems or strengths, or to track how they change over time. The staff at CORC are often part of discussions about what the experience is like for children and young people who are coming for support. How do young people relate to filling in outcome questionnaires? In this video project, some of the mental health practitioners from CORC member services and young champions from the Anna Freud Centre have shared their views. First, let's hear about why mental health practitioners can find outcome measures useful.
I would explain this is really useful to help me to understand what might be going on for you. You know, lots of people, we make our assessments from professional training, but also we all have our own frame of reference from our experience, and I think this helps us to be more objective as well. I think what I would do is I would explain it as that this is not a negative thing about you, this is not about a judging thing, this is about helping me to understand you better.
Instead of making assumptions, if they're applied properly, the measures will ensure that we're capturing the symptoms or the actual issues, problem, use the measures effectively. We find that we don't miss problems that maybe we would if we wasn't using the measures. Sometimes, just in basic clinical interview, things can get sort of looked over, and until we actually see it, a lot of young people won't actually have an understanding of different types of the problem until you see it and go, oh yeah, do you know what, when you see the question, you might say, I didn't even think about talking about how bad my sleep was, for example. And that's being prompted often by looking at the form. So the forms are really essential in letting us understand the young person better.
Okay, that's great. But is this about the practitioner or about me, the service user? How am I involved, and how does this become helpful to me and a meaningful part of my support?
I do think that these outcome measures are good, but only when the clinician does go through the results with the young person, because I've had experiences both where the clinician was really good and went through it with me and showed me the tables and the charts, and I felt like I really understood why we were doing that outcome measure and what was coming from it, whereas I've had experiences doing exactly the same questionnaire where they've got me to do it in the waiting room before my appointment, taken it, and I've never seen it again nor heard about the results. So I think it is really important that if they are going to do these questionnaires, that they do feed back to the young person.
I think the outcome measures should be so mutually beneficial to both therapist and client. And I've found so often in like past therapies and things that they're just not. They're used for the therapist or the whoever. They're kept for them, they're kept for their resources, they're kept for their research or whatever they're doing with them. And you never see or hear of them again, and you don't know what they're thinking about what you've said. It makes you really paranoid and all things like that.
I've completed outcome measures, but then it's sort of like, that's it. I've never heard anything about it ever again. And I've sort of been left wondering, okay, this time's been taken within my session to go through all of these outcome measures, but then what next?
I didn't really know why I was doing it. They said, oh, this is just to help me, but I think they needed to explain a bit more why it was necessary for me to do it and how it's going to improve my journey to recovery.
I can remember witnessing some clinicians where, you know, in sort of my past roles, and they've actually apologised to people, they've apologised to families or to young person when they're using the outcome measures, and I'm not really quite sure what they're apologising over. It feels like they're apologising because it's irrelevant. And that also reinforces the fact that they don't believe that it's useful.
Giving sort of like an outcome measure for the sake of doing one isn't going to be useful, but actually maybe just explaining how an outcome measure will fit into someone's therapy or their treatment. So for example, it could be used to capture or monitor progress. It could just be used to see what's going well, what's not going well, and it could be used to help find out more about the person, because sometimes, like, I know when maybe filling out like a questionnaire outcome measure, I sort of then look back at it and it feels like it makes sense. So it provides some sort of like clarity on what's going on. So it can be used for different reasons. And I think it's just exploring what is the best way to use them, so you're not just using them for the sake of using them.
I think it's essential that young people are involved in looking at the measures, but also having a little bit of a summary of what the measures are for, why we use these measures. I think that would be a really good thing. And then at the end of that, seeing how that form highlighted where the therapy goes next. Because often it can be quite difficult to articulate that in words sometimes.
Outcome measures can be a really useful tool if they're utilised at the right time and worked into, your treatment, your session.
So explain, go through the results and make it feel like part of the sessions. Otherwise, people might feel paranoid, vulnerable, or like you're not listening. It is also essential to consider whether the service user requires support when answering these questions. Not every young person feels comfortable or safe when filling out the questionnaires.
I think it's really important to do the questionnaire with the young person, because I find, particularly as someone who's autistic, I often find it hard to understand what the questions really mean. For example, if I was that young person doing the questionnaire, I would find it quite stressful, but also might not answer in the way I probably should, because some of the questions I wouldn't understand how they're supposed to be understood.
These people are having probably emotional regulation problems or something like that if they're with you. So it's really important to actually draw on those emotions and make sure they're feeling supported in every step of the therapy, including doing measures. Just saying, do you understand the questions? Do you need anything rephrased? Do you feel comfortable right now? Do you feel safe right now in yourself? Do you feel like you can answer these effectively? Making sure they're fully explained, fully discussed. If there's anything that's going to happen because of the measures, taking some real time to talk through it and explore the feelings around it. Like, for example, I found that outcome measure sheet really difficult because it was making me really face what I'm feeling. Okay, would you like to talk about that? How would you like to feel next time you do it? How would you like to be supported next time you do it?
So the young person might need you to make sure that they feel supported with those questions. And some young people do say that they experience outcome measures as a tick box exercise. What can practitioners do to avoid that?
It is at its core a scientific tick box, and that's not using it in a negative way. It is physically ticking a box or something. But it doesn't mean you can't expand on that, and it has to be quite emotive because you're in an emotional practice.
So how I usually talk about it is saying to the young person, this, I'd really like to do this with you. It's answering lots of different questions, but at the end of it, it really gives us an idea and can point us in the right direction. It's not the only thing that we're going to use, because we're going to look at things about your history and things that are happening now that gives us a really good picture.
And it adds a shared understanding with the young person that I'm not just going to talk about your symptoms. I'm actually going to talk about when there's even the slightest improvement. I'm actually going to talk about what difference that's made to your life.
We have to recognise that sometimes it will feel like a tick box exercise, but if practitioners explain why this information is useful, explore around the questionnaire and use other information as well, then it can help young people feel that it is just one part of putting together a picture of who they are and how they're doing. It is really all about how you do it as a practitioner and how you acknowledge that the outcome measure is a part of the relationship.
Ease it into a conversation, then that would be way more comfortable than just being handed a form.
It's less about the outcome measures themselves and more about how you sell it positively, because if it comes naturally through a conversation in a safe space that you've established beforehand with the person that feels comfortable sharing this stuff with you, it will not even be a hard conversation to have. It will just come naturally through the conversation that you're having.
I've heard lots of times practitioners saying that it's another job to do, that you haven't got time to do an outcome measure. You've got to make the time. It's got to be part of the session. It's got to be done collaboratively. I think we need to change the way that we work to make sure that that's what we're doing, because that's what young people are saying, is actually valuable.
So the questionnaire is only as useful as the way in which it is used. For it to be worthwhile, you need to know why you're completing it and be completing it as part of a trusting relationship. And finally, don't assume what the person will think and feel about outcome measures. Give us information, as much choice as you can, and above all, listen.
Young people don't like them. I say, how do you know? Have you asked them? And the usual response is no. I think that as adults we make assumptions about what young people might like and might not like.
All people in general should have a choice on how they're used. So it's never a conversation when, for me it wasn't, at least with outcome measures. It was just given to me. I had to complete it. I didn't have a choice. I couldn't opt out, couldn't choose to skip questions. And they did point out when I skipped any question, they were like, we need you to answer that. A lot of people that facilitate therapy or do counseling or clinicians tend to assume a lot of things that young people think about, like what we like, what we don't like, what is going through our heads. And I think most of the times it's supposed to be a conversation. If you think something, just ask and we can tell you, especially in terms of routine outcome measures.
Practitioners told us that outcome measures help them to understand what is going on with young people's mental health and their support. The young people we spoke to added layers to our understanding. Ultimately, it all depends on how you do it. Explain why you were asking me to fill it in. Go through the results with me and make the questionnaire feel like a part of our sessions together. Think about what it will be like for me to fill it in and be there to support or help me if that is what I need. Explore my questionnaire responses with me and be clear that a questionnaire score can only be a part of building the bigger picture of who I am and how I'm feeling. Your asking me to fill in the questionnaire is impacted by our relationship. If I trust you and understand where you are coming from, then it will be more meaningful. Give me choice where you can, and don't make assumptions about how I will feel about the questionnaires.